That's a good question. What makes me an expert? And I'll tell you that I don't feel like I'm an expert. What I am is I think I have a unique experience in that, like many of my colleague physicians that are in the audience tonight, I've spent I've spent all 26 years of my career in clinical medicine practicing in a community, in the trenches. And during that period of time, I've had the opportunity, along with my patients, to try and navigate the barriers that have been thrown in front of us by this American healthcare system. After all, since we've all been this high, we've been told that this is the United States. We're the best country in the world. We're the greatest country in the history of mankind. And as we get older, we are told that the American healthcare system is the best healthcare system in the world. And I think that there's plenty of evidence to support that argument. First, if you look around, there's no doubt that America is the world's leader in healthcare technology. You can go on the corner of almost any small town here and get an MRI scan or a CT scan. In addition, we have medical schools and research universities that are without peers throughout the world. We have, as physicians, at our disposal a vast array of drugs and pharmaceuticals that can ameliorate and now even cure diseases that only a generation ago were felt to be uniformly fatal. We have a veritable army of brilliant and well-trained physicians, like many in this audience, who are ready, willing, and able to provide care to our citizens. And even in these most dire of economic times, I have to remind you that the United States remains the wealthiest nation on the planet. It seems intuitive that if you've got the best healthcare system in the world, most likely your citizens are probably going to be the healthiest in the world, and if they are, they should live the longest. Well, in the United States, we finished 30th in the world. We're tied with Cuba for life expectancy. Now, it's not horrible, but we finished below every other industrialized, westernized nation in the world. We've got to finish number one in some categories, and we do. We finished number one actually in two categories. The first, the percent of gross domestic product that we spend on health care. In the last survey by the WHO, we spent 17.3% of our gross domestic product on health care. Number two in the world, behind us, was Switzerland at 11.6%. Now, the other place where we lead is in per capita spending. In the United States, we spend a little over $7,300 per person on health care in this country. Number two in the world is Germany at $3,200. So if you look at those facts, it seems to me that we're spending more than twice as much as any of the other developed countries, and yet we are mediocre at best when compared with the standards set by the World Health Organization. We like to blame everybody else but ourselves. And there's plenty of blame to go around. And I think what we should do is look at the different forces in medical care and see what roles they play. And I'd like to start with really the villain du jour now, which is the insurance companies. After you see what Anthem Blue Cross did to rates the last couple of months here in California, everybody loves to attack the insurance companies, so I think this is a good place to start. When the private for-profit insurers took over managed care, things changed forever. Focus changed. It changed from patient care to profit. If you were a family doctor or a primary care doctor, you had to see more patients. You had to push them through faster. If you were a surgeon, you had to do more surgeries. You had to do more surgeries. Maybe something that you could watch needed a surgery, because that's the only way you kept up your income. We started seeing this growth of mid-level practitioners for the first time, physician's assistants and nurse practitioners. And now when you went to your family doctor, you never saw them. You saw the PA or you saw the nurse practitioner. And we started putting these walls between patients and their doctors. Prior to '97, there was only one country in the world, New Zealand, that allowed pharmaceutical companies to advertise prescription drugs directly to the consumer, direct-to-consumer advertising. That practice, for obvious reasons, was banned in the United States until 1997, when, thanks to the money being thrown around by the pharmaceutical lobby, it was pulled. And for the first time, pharmaceutical companies could advertise directly to you for prescription drugs. Now, what did that do? Well, in 1997, when the ban was still in effect, the cost of pharmaceuticals in the United States, the total cost was about $70 billion. A mere 9 years later, after the ban was lifted, it was $290 billion. The number of prescriptions in this country increased 60% to almost 35 billion per year. Number three, the average cost of a prescription drug went from $30 in 1997 to $68 in 2007. And even more surprising, the advertising budgets of the pharmaceutical industry went from about $780 million in 1997 to over $5 billion in 2009. The next group that I would like to place in our police lineup is probably one that I'm not going to get a lot of argument from, and that's America's lawyers. There are areas of this country that no longer have access to a neurosurgeon, to an obstetrician, to an anesthesiologist, or to an orthopedist, or to a trauma surgeon, because malpractice risks sent them out of business. They left the state, they left the area. The other group, the next group that I'd like to talk about, again, I doubt if I'm going to get much complaint, is America's politicians. You know, in this last election cycle, the hospital lobbyists gave campaign contributions in the range of about $33 million. The pharmaceutical companies, about $42 million. The insurance companies, about $66 million. Healthcare professionals, about $130 million. And lawyers, about $299 million, just in the last election cycle. So it should surprise nobody in this room that there's no government option in this new bill. Now for the hard part. I'm going to talk about myself and my colleagues, physicians. What's our role? What's our culpability? We did. In response to managed care, we started practicing assembly line medicine. We'd walk in and have one hand on the door while we asked you where it hurts, so we could get a picture of where it hurts and send you to somebody that cares about that body part. We started ordering tests rather than examining patients and taking a history. We didn't listen to you. We didn't have time. We didn't have time. In order for us to keep our incomes up, I didn't have time to ask you a lot of questions. Just let me order a test. And we lost the art of medicine. Now, so I'm going to take myself and my colleagues and I'm going to put us up there as well. Nobody escapes scrutiny. A few years back, I attended a healthcare conference, and the panel was talking very much about the very same things that I've spoken to you about tonight. And it was very interesting. It was very provocative. And at the end, they opened it up for questions. And so I walked up and I asked a question that I thought was pretty innocuous. I simply said, hey, this was a terrific speech. This was great. I said, you know, these bastards, these pharmaceutical guys, we got to go after them. We got to go after these insurance companies and these greedy doctors. This is cool. I said, but I find intriguing one thing. Not one of you panelists mentioned a word about the role that the American public, the culpability of the American public in the demise of our system. What's their role? I said, look, they eat too much, they're obese, they drink, they don't exercise, they smoke, they drink, drive, don't wear the seatbelts, and for some reason, you don't even talk about them. What role did they have to play? 33% of adults are obese. What's worse, about 18% of children are now obese, and the prediction is that by the time they reach adulthood, there's going to be about 40 to 60% of the Americans are going to be obese. Currently, there's 25 million diabetics in this country. That's the good news. There's 57 million people who are pre-diabetic or borderline diabetic who are going to be stepping over into that category very soon. At any given time in this country, 25% of all hospital beds are filled by patients whose admission is directly related to alcohol abuse. You know, they'll tell us, I want the government out of my life. I'm sick and tired of the government telling me I got to wear a seatbelt or I got to wear a motorcycle helmet, for crying out loud. This is America. This isn't Russia. I should be able to do what I want. But they have no problem with that government interfering with them when, as a result of not wearing their seatbelt or their motorcycle helmet, they come into our emergency room and run up a bill of $140,000 or $150,000 and they're uninsured. So I think that the American patient deserves an equal seat at this table.